So today I'm going to be performing an up-close and whispered medical examination to help you relax and to help you tingle. I've selected the best in-class medical devices. Some of them are illuminated, and we're going to begin by looking with the ophthalmoscope, focusing on the cornea of the eye, the 5-layered structure that the light travels through. Coming up closer, focus on the crystalline lens. You can alter its focus there. So the crystalline lens is clear in all the zones there. Okay, I'm just going to focus on the optic nerve there. So really we're looking for any swelling, indistinct neural retinal rim, any peripapillary atrophy, and just noting the cupping, the vascular arrangement on the optic nerve there. Excellent. I'm just going to alter the focus, switch the light. This light just helps me observe the blood vessels in a little bit more detail. Good. Okay, now I want you to look into the light. Now we're just looking at the macula and the fovea, the central portion of the eye, which is associated with fine vision. Lovely. Okay, I want to switch to the left eye, and again I'm going to bring the focus back to the cornea of the epithelium Bowman's stromal layer, Descement's membrane, and the endothelium. Good. And now onto the crystalline lens. That looks clear again, and onto the optic nerve. Now the optic nerve here is pink and defined. The cupping is about 0.5 cupping. There is no tortuosity or hemorrhaging on or around the disc. There's no congestion there. No congestion on the disc. Okay, I'm just looking with the red free light there. I just want to see that the blood vessel course is okay. I just want to check that there's no nipping or tortuosity in the blood vessels. Good. Just looking into the light now. And again, just observing the macular region of the eye. It's the site where you could see drusen, pigmentation changes, hemorrhaging for example. And this is the site where we can see macular degeneration sometimes. Good. Excellent. Okay, so I'm going to use the otoscope here to look inside your ears. Okay, if you turn to your left, into the ear canal there. And really what I'm looking at is the level of wax in the ear. I'm also looking for any scarring or damage from previous events. Looking for any trauma that may have taken place, any evidence of that. I'm also looking for any discharge, any inflammation on the tissue there. And then we can take it a little bit further back and look at the optic nerve there. Then we can take it a little bit further back and look at the eardrum there. It's fine, there's not much in the way of deposits. Lovely. Just turn the other way now for want to look in the left ear canal. I'm seeing a normal level of wax in the ear there. No discharge or scarring. Eardrum looks fine, there's no perforations. There's no inflammation. Excellent. Okay, so the ears look fine. I'm going to set up another test which involves coming up close. This is the Perkins tonometer. It's a form of applanation tonometry where it touches the front of the eye and we can take a pressure reading using the scale there. Okay, firstly I want you to look up to the ceiling. I'm going to place a little drop in the right eye and the left eye. This is anaesthetic drops. Okay, just take a few blinks. I'm going to be looking through the viewing portal as it gently touches your eye there, moving the scale, and then I can record the reading of millimetres of mercury, and then we will know what the intraocular pressure is there. And again. Okay, so for the right eye we have a reading of 15 millimetres of mercury. Okay, I'm going to observe the left one now. Blink, and we'll bring it against the surface of the eye there. Just makes delicate contact with the cornea. Excellent. Okay. A reading of 16 millimetres of mercury there. That's 16 mil of mercury. Okay, I'm going to use the light and the tongue depressor to have a little look inside the mouth. Okay, so I'm just observing the tongue and the teeth and the inner tissues. Just raise the tongue for me, please. Look underneath, place the tongue down. Okay, just swallow now. Okay, the back of the throat, just say ah. And again. Good. Open your mouth again now. Going to have another look this time. Just looking along the gums. Looking for any signs of decay. Or looking for any lesions in the mouth. And now for the upper portion. Looking at the gums there. That all looks fine. Okay, I have a little illuminated magnifier here. Now we've looked inside your eyes, but I would like to observe the external ocular surfaces. So just look straight through the magnifier towards my face. Now I'm just looking around the eyes, looking for any blepharospasm, any twitching. Good. I'm also looking for any lumps or bumps around the surrounding area there. Looks clear. And now I'm just looking at the eyelashes. Looking for any trichiasis. Looking at the colour and the length of the lashes. And that looks fine. All normal. Okay, just looking down, I'm going to observe the upper lid and skin, the surrounding tissue. Okay. Looking up to the ceiling now. But come really close to see the lower lid. To also see the openings there next to the lashes. Adjacent to those are the meibomium glands. Those are the meibomium glands which produce the lipid layer of the tears. That's grand. side, I'm just looking at your right lower puncta, otherwise known as your tear duct. Let's look at the upper tear duct in the right. So I want to ensure that we have a adequate drainage system.